Hello guys. Good evening, good afternoon, good morning, depending on where you are watching us from, depending on what time you are going to see this video. Guys, I'm so excited coming to you and sharing tonight, coming to you and reflecting together with you. Guys, as you all know, I'm a healthcare care assistant in the UK. I came to the UK on a skilled worker visa 2 years ago, and so far care has been good. So far I'm enjoying what I do. So far, I'm learning a lot in my role, and no wonder why I always find it quite easy for me to come here and share with you my experience, guys. And as you all know, I love to say the fact that I come here and share with all of you, the fact that I do come here and reflect does not mean I know everything. I'm still learning, I'm still growing, I'm still exploring care as a career. Guys, just type in the comments if you can hear me. Type in the comments if you can hear me. So guys, I will come here and I will share what I think. And as I was reflecting today throughout the day, I thought, well, why not do a series to try and bring understanding, bring an in-depth insight into care work as a role. Why did I choose to do that today? It's because I'm African, I'm from Zimbabwe, and a lot of people have got so many misconceptions, so many mixed feelings about care work as a role. To say, well, it's that job where you don't grow, it's that job where you're stuck in personal care. But then I thought, well, I'll come here and I'll educate, I'll come here and I'll give insight, I'll come here and we can reflect together. If you've got anything that you want to add, if you have anything that you feel we need to talk about, you can just pop it in the comments or DM us, and then we can come and reflect here together. Guys, thank you so much for always supporting us. Thank you so much for standing with us. And thank you so much for showing us love. We do appreciate you. Continue to share our content. Continue to share our videos. Continue to share handles to our platforms, guys, because our goal, our aim is for each and everyone to understand and to be inspired by the diaspora journey, by the journey abroad. And when we do say that, it's not to say people that do live back home are missing out, or people that are still back at home, or people that choose not to pursue diaspora living are not focused. Because I do have family and friends who are doing so well back home, and a big shout out to you. So guys, today I'm going to talk about one of the few myths about care work. To say is that career which has got absolutely no growth. It's that career where you join in as a healthcare assistant and then that's your end. That's your fate. Why did I choose to come and share about that one? Is because I've been working in organizations. I've worked for organizations. And guys, before I go further, disclaimer, when I do come here, I share my views, my opinions, and my feelings. I do not represent any organizations or any organization's feelings. So these are my thoughts, my views, and my feelings. So one of the things that I discovered is care is just a gateway into a broad industry, an industry that is full of opportunities. And we are going to talk about some of the opportunities that do come directly from being a healthcare assistant, directly from being a health support worker. So what are some of these roles, and how long does it take for somebody to, grow into these roles? And what is it that somebody can do or has to do to actually start to see growth, or to actually start to navigate some of these roles? So suppose you join in as a healthcare assistant, like what I did. Some of the roles that I discovered that are within the care industry is besides us, the healthcare assistants, above us, there's care coordinators. It's a different role to what we do. Of course, some of them, depending on how big your organization is, some of these care coordinators do actually do the actual work, or some are actually in a more supervisory role, more of a managerial role. What is it that they do? These are the interface between clients, or between the people that you serve or the people that you support, and the office, or maybe the senior management. So what is it that they do day to day? These are the people that us as carers, these are our go-to people for support, go-to people for reporting, go-to people with any issues. And these are also the people that are in contact with the clients whenever there's an issue, or just checking for compliance, or any audits or anything. These are the go-to people. These are our managers as carers. So above us, besides us carers, there's the care coordinators who care coordinators who do the day-to-day running, day-to-day coordination of care within care work. Aside the care coordinators, maybe depending on an organization, there could be a registered manager. Guys, when a profession is called a registered profession, this could be an equivalent of maybe social work, nursing, those registered roles where you need to be associated or affiliated with the professional board, where you're actually your role in what you do, there's a board that regulates what you do. So it's actually a licensed profession. But all these roles can stem from you being a healthcare assistant, and then you upgrade and then you upskill and then you can get that far. If you have Google or if you have data, just go and Google registered manager salary. Then you can see these are well paid, highly paid roles. But again, depending on where you work, you would find if you work in support work, there are people who are called case managers. These work directly with case to case, whereby probably maybe they've got maybe 2 or 3 cases under them that they are managing. What do I mean by a case probably, if you are well versed with support work, a case is probably what they term a client. One client is referred to maybe as a case, depending with the terms that you use within your organization. So they're actually those people who are called case managers. Those people are above carers. These basically coordinate all the care associated with that case or with that package in particular. Mostly you find these roles in very big organization or those specialized organization where probably you're supporting those people with complex care needs or multiple care needs or specialized needs. So that's where you find like case managers, because there's a lot that could go in there. There's a lot that is involved in there. So these people basically are these are the people that are micromanaging the care that goes into that case in particular, or that client in particular, or that service user in particular. Guys, if you're joining us today, we are talking about demythifying. A lot of people do believe there is no growth in care. You're a healthcare assistant, you die healthcare assistant. So I'm just here to just bring an insight into some of the roles that stem directly from healthcare assistants, what you can become over time, what you can become through training, through upskilling within your role. Why did I choose to come and say this today? It's because a lot of people do say things negatively. A lot of people do mock people. A lot of people do not feel maybe it's for them, or do not feel the need to actually capitalize or maximize on this opportunity because they do feel there's no growth. I'll just live a life of personal care. There's more to life than personal care within the care role. There's more that happens within that role. So I've talked about care coordinators, I've talked about registered managers, I've talked about case managers. So depending again on how big your organization is, actually in some organizations, they've got their own in-house trainers. What this could more or less be like, well, they've got trainers, they also have got maybe training managers. And when you do engage with those people, and when you ask them, most of them or some of them have actually started from the bottom where they were carers, and then with experience, with upskilling, with training, with upgrading, they end up training managers. These actually are regulated by training boards, or are affiliated with some of these colleges or institutions that actually offer certain training. So you don't just wake up and then you're that, no. But then you can start from maybe being a healthcare assistant, and then probably depending on where your interest is, you can end up maybe within the training department. Basically what we are saying, we're just trying to bring an insight or to bring awareness around some of the things that people can actually start looking at. Probably you're not looking into going to uni, but then you're feeling sorry for yourself, you're getting depressed, and you're going like, well, my life is just not going anywhere, it's not going to go anywhere. One of the things that we need to start doing is to look at things broadly, look at things in a broader, insightful way. So these are some of the roles that I actually like have seen and go like, what does it take for somebody to be a training manager? It takes experience. Because yes, you could go to school, you could do all that, but then if you do not have the hands-on training, you may not be so well versed with the things that happen on the ground. So I've noticed that some of the training managers that I've come across actually started from being carers, and then they upskilled, and then they continue to go through that path. Of course, there's exams and everything, but then if you are in this country, or if you do live in the diaspora, guys, there's flexible learning. You go through all the training at your own pace. But guys, we are talking about some of the careers that stem from being a healthcare assistant. I've come across training managers. So depending on what department you come across, if you are in the UK, you know how much they prioritize training. Training is at the core of everything. No wonder why I always want to say, whether or not you've got experience, care is for everyone. You can always start from care. And then what these organizations do, or what they are required to do by organizations that do regulate them, including the CQC, is there has to be training, mandatory training, and this training is carried out on a regular. So wherever you go, if you're in care, definitely training is at the core of everything. So those are some of the roles that you can actually upgrade, upskill, and then end up in training, depending on what your passion is. Guys, I'll go on to the next role that I want to talk about. You'll find that depending again on the size of the organization that you work for, I've come across very big organizations where they've actually their own clinical departments, whereby maybe they do require like nurses to actually work for them because of the nature of work that they take, the nature of contracts that they handle. So it's actually another pathway that can stem from you being a healthcare assistant, and then you get groomed into that role. Probably those are some of the organizations that do offer apprenticeships. And when we do talk about this organization, definitely we cannot have a conversation and not talk about the NHS, because I love the NHS. I do enjoy working for the NHS. So I do talk about it to say, from being a healthcare assistant, then you begin to realize, okay, I can become a nurse, I can train and become a nurse. Again, this goes on to where we say, what is it that you want to become? What are your end goals? What are your strengths? What are your strengths? What are the things that you're passionate about? So there is actually opportunities out there. And we're not saying, but when we say opportunities, we're not saying everybody should end up in university. Because I know if you are a newbie in this country, if you are a newbie in the diaspora, definitely we cannot talk about upskilling and not talk about the cost of education. Because of the nature of our visas, definitely depending on what stage you are at some point you may be required maybe to pay international fees if you decide you want to pursue tertiary education. So some of the things that you can do is actually maybe target to go through the NVQ route. A lot of people are going through that. A lot of people are at different stages. And some of these people, some of these roles that we see, some of these big titles that we see, and some of these people in these roles actually have just done their NVQs, and then they continue to upskill, and upskill. There is NVQs that will maybe get to a point where it's an equivalent of a degree, an equivalent of a master's, an equivalent of a PhD. I don't know much, but guys, I've seen people that have followed the NVQ route, and they have gone on to rise within their organizations. So this is for those people that decide to be loyal. Actually, loyalty pays off. I salute people that are loyal to these organizations. I salute people that choose to stick with organizations that brought them from home. A big shout out to you. Just to not neglect your passion, to not neglect your growth, because you're loyal. In that loyalty, seek to upskill, seek to upgrade, seek also to navigate certain pathways and become something for yourself. Guys, today we are just reflecting and reminding one another that care is not just about personal care. Care is not a dead-end career where you are a healthcare assistant and then that's the end. There is more and more opportunities out there. We are not even going to start to talk about people that decide to pursue the uni route and then they go on to become social workers and everything. So there is growth, guys, in this career. It's just a gateway. A big shout out to everybody that's joining, guys. Thank you so much for your love. Thank you so much for your support. We do value you. We do appreciate you. So today we're just reflecting and just saying care is not just that dead-end career. I've spoken about care coordinators. I've spoken about registered managers. I've spoken about case managers. I've spoken about pursuing training. I've spoken about pursuing clinical roles. Maybe in some organizations, these clinical roles, maybe someone is a nurse, but then they don't want to work in a hospital setup. I've seen people that join care companies and then they occupy those advisory roles, because I mean, in care, people do administer medication, people do a lot of things which are clinical. These other clinical things that people do, things like peg feeding, things like nasogastro, what, a lot of things. So there are people who are actually nurses, but then they do not work for hospitals, but do work for these care companies, and then they offer a support and advisory role. So it's something that actually someone can actually pursue. Other people can actually pursue maybe therapy roles, again, depending on the organizations that you choose to work for. If you are working for a company that maybe dwell much in maybe a care company that caters for children, maybe learning disabilities and things, you find that they employ, besides just support, they have got certain therapies that they do with these maybe young adults or these children. So you can actually pursue that path where you are, maybe you're into rehab, maybe you're into speech therapy, maybe you're into physiotherapy, a lot of other, therapy things. So it's not entirely to say if I'm a healthcare assistant. So these roles do vary depending on the companies that you work for. You find there are some healthcare assistants who never even do personal care with people, because maybe they're supporting somebody who is, near independent. They do everything for themselves. Right? So this is just to demystify people that would think, this healthcare thing is not for me because I'm not into personal care. It's not my thing. There is other things that happen. There are other things beyond personal care, and there is growth as well. Last but not least, guys. Well, not just last, but one of the things that I want to add on is the fact that it's these people, depending again on your vision and on your hard work and on your resolve. I've spoken to people that started off as healthcare assistants, and now the very same people are running care companies. So what is it that they did that is different? I said about experience, I said about exposure, I said about following the NVQ route. They'll tell you, I didn't go to uni, I just did my NVQs, and then I became a research manager, and then I just thought, well, I could run a company. And now these are the very same people that are employing us from Africa, from Zimbabwe, from wherever, into this country. So guys, I love these people that have been in these countries for so long. There's so much that you can learn from them when you do ask them, when you do go to them and say, how did you get here? How did you manage? How was it like for you? Where did you start? Most of these people, they will tell you, I worked in care. One of the things that I love to say on this platform is to say, in whatever place that you are in whatever role that you are in, don't just go there and say, I'm here to work. Also go in there and study the system. Study the system so that if you do feel it's for you, you begin to do the very same things. If you do feel you are for that, then we begin to take those systems back home, those systems back to where we came from. So whilst you're in those roles that you're in, whilst you're in those organizations where you're at, study the system. It's one of the things that is quite important. So guys, instead of just thinking and imagining, it's a dead-end career, I'm finished, I'm doomed. The very same people who started off as carers are now the very same employers that do employ us, same employers that are running these companies. Guys, I'm not even going to touch on some of the roles that do come up, depending again on the organization that you'll be working for. There is other supporting roles that actually require someone with care experience as well. You can, within the same organization, then branch into other things like, so many apprenticeships are offered by these companies, depending on the size of the organization that you work for. You can actually say, well, I've got a finance background, I've got an IT background. You can still work in care. You can say, I've got an engineering background, but you can still integrate that into your care work. So guys, there's so much that we can do. I just thought I'll come here and answer a certain question that could be in a lot of people's heads, to say care work is just a dead-end career. There is no growth in care work. There is nothing. You just become a healthcare assistant and then that's it. And also I wanted to answer the question to say, if somebody decides to be loyal and stay or stick with the company that I'm working with, does that mean they'll never grow? No, they can grow. That experience that you have, add a little bit of training, be it in-house training, be it external training, and then you begin to aim for those roles, you begin to aim for those spaces. Guys, a big shout out to Mr. Phil. He's here, he's on this platform. Thank you so much. So these are some of the things that we can do as a people. These are some of the things that we want our people to navigate and think about. Guys, this is a conversation that I've started. I'm going to do a few series whereby we are going to be reflecting on some of the myths or some of the things that people without in-depth knowledge of what we do think about care work. Guys, I think this is it for today. Thank you so much for tuning in. Thank you so much for always supporting us, guys. We do hope to continue to share, to continue to inspire, and to continue to grow as a community, guys. Thank you so much. And I wish you to win anyway. I wish you to win in every situation that you're in everything that you do. Have a winning mentality, have a focused mentality, have a success and excellence mentality. It's a good night from me to you. Thank you. Bye.